Good morning. Over the last 7 days, Iowa has seen an increase of more than 22,000 new COVID-19 cases and an average statewide positivity rate of 17.5%. This is a decrease from the 7 days prior when new cases totaled 36,000, and the average positivity rate was 28%. At a county level, we're seeing that positivity rates are beginning to stabilize in many areas, and these are welcome signs. And while we may be cautiously optimistic, we have a whole lot of work to do to bring the numbers down to a level where we can safely manage the virus while getting life back to normal. Hospitalizations remain high across the state, but yesterday was the first day in weeks where we saw a slight decrease in the overall number of Iowans hospitalized. So this gives us hope as well, but one day is far, far, far from a downward trend. Over the next week, it will be critical that we see hospitalization rates begin to stabilize. Every day, we are monitoring it closely and working directly with hospitals and healthcare systems to understand their situations and assist as needed. The vast majority of those hospitalized continue to be older Iowans. Currently, 74% of all hospital patients with COVID-19 are age 60 and older, which again underscores the importance of taking measures to protect those that are most at risk, whether due to age or underlying health conditions. As we approach the holiday season and even small gatherings occur among family members, we just need to be mindful of how our behaviors could impact others. Give you an update today on long-term care facility outbreaks. Later today, an additional 20 long-term care facility outbreaks will be reported. And just as a reminder, a facility moves to outbreak status when 3 residents in the facility test positive for the virus. That will bring the total number of active long-term care outbreaks at this time to 114, and I think we have somewhere around 443 long-term care facilities. This afternoon, we also will do an update to the long-term care dashboard on coronavirus.iowa.gov, and it will report the number of new cases. The additional information will report the number of new cases over the past 14 days in facilities with active outbreaks. News of long-term care outbreaks is, very concerning as it impacts our most vulnerable population. And as we saw earlier this year, the consequences of COVID-19 in these facilities can be devastating for residents and their families. The Department of Public Health and members of my team are also in regular communication with the long-term care associations and partners on how best to help facilitate during these challenging times. We're ensuring that that adequate infection control measures are in place. To make sure that they are in place is critical to preventing the virus from entering a facility or stopping its spread after an exposure. Training is available on infection control, appropriate PPE use, and emergency planning. And in an effort to more effectively assist long-term care facilities with staffing concerns, the state has provided updated guidance on preparation and implementation of emergency staffing plans. The State Hygienic Lab continues to support our long-term care facilities with testing needs, including when an outbreak occurs. So in addition, the lab is also providing BinaxNOW antigen test cards to support routine surveillance testing, and more than 240,000 cards have been distributed to facilities across the state for this purpose. I'm also announcing today that $14 million of CARES funding will be allocated to Iowa's long-term care facilities to assist with the increased cost related to testing and staffing. Like our hospitals, it's important that we also provide assistance to long-term care facilities at this time, and that every Iowan continues to do their part to protect the most vulnerable of our healthcare workforce. Also, as positive cases have increased, so has the caseload for investigations conducted by public health departments, whether at the state level or locally. The volume of cases at this time requires additional resources, and as we announced earlier this week, we are working to increase our case investigation resources. In the meantime, it's important that Iowans are prepared in case they or someone in their family tests positive. So today I've asked Dr. Padati to help inform Iowans about what they need to do if a member of their immediate household tests positive for COVID-19. Dr. Padati.
Thank you, Governor Reynolds. So I want to talk a little bit about two traditional public health activities that we do for a variety of diseases and have done for a long time. And those are both case investigation and contact tracing. So when we talk about case investigation, we're talking about an individual who has received a positive COVID result. So they're infected with the COVID-19 virus, regardless of whether or not they have symptoms. We reach out to those people and ask questions about them, and we do that for a couple of reasons. Partly because we want to understand a little bit about these people and who the virus is affecting, right? So your age, maybe your underlying health conditions, what you do for a living, and that helps us better understand a virus that, remember, we haven't known about for just under quite a year now. So as we get a little bit more information about the individual and who they are, we also try and understand a little bit about what activities they might have participated in that could have put them at risk for becoming sick. Now, because this is a person-to-person virus, it can be a little bit hard to know that for certain, especially as people engage in increasing numbers of activities, which we do see. But when we've identified that person who's a case, so that's somebody who's infected with COVID, the public health recommendation is to stay home for 10 days, and we call that isolation. And so anybody who has received a positive result indicating that you have COVID-19, we ask that you stay home for a 10-day period, either from the beginning of your symptoms or from the day you got that test positive if you never had symptoms. And we do that to limit the spread of the virus to other people. Now, in addition to that, in the course of those conversations, we ask people about who else they've been around. And as numbers have increased, we've increasingly focused on high-risk situations, which includes households. Now, we know that households are a place where all kinds of illnesses can spread quickly, whether we're talking about flu or norovirus. When we live together, there are more chances for a virus that moves from one person to the other to move between us. And so we want to help do what we can to protect other people who may have been exposed and are at higher risk from becoming sick. And so that means we start to talk about quarantine, which is the recommendation for healthy people who have been exposed to somebody with COVID to stay home themselves. And we ask people to do that for 14 days, regardless of whether or not they have a negative test. And the reason is because you could still be incubating the virus, or you just might not have become sick yet. And so by asking people who are sick to isolate and stay home, and by asking people who are exposed to someone with COVID to quarantine and stay home, what we're trying to do is limit the spread of this virus from one person to the other. And so it's important that everybody continues to follow that public health recommendation. Now, even if you don't fit into either of those two categories that I just described, people who we ask to isolate or people who we ask to quarantine, I want to remind everybody that there are things that we can all do to help limit the spread of this virus and optimize outcomes for vulnerable Iowans and maintain our healthcare resources. And I know you've heard this before, but that continues to be things like frequent hand washing, using face coverings, and social distancing. And those things are going to continue to be really important for the coming months. I want to acknowledge that I know that there are many people who are tired and that this has been hard. But there are some good things that we're starting to learn around vaccines and around immunity. And so I would ask every media outlet, every person watching at home, please help public health, your public health professionals, your healthcare professionals, share these messages about what you can do to stay healthy. I would think about the people you love and the people who love you and recognize that there are things that we can all do to help keep people safe and healthy, especially during this holiday season. Public health cares very much about every single person here in Iowa, and we're going to continue to work together to help keep people safe and healthy this holiday season. Thank you.
Thank you, Dr. Pedati. This information, I think, will be very helpful for families to know what to do if they're faced with this situation, especially as we have our college students returning home over the coming days for the Thanksgiving holiday. So I appreciate your information. Since March, as Dr. Pedati indicated, you've heard countless times from me, from Dr. Pedati, from the Iowa Department of Public Health, and from your local public health officials about the things that you can do to reduce the risk of getting and spreading COVID-19. Social distance, wear a mask, wash your hands, stay home if you're sick, all very simple steps that truly are the best defense against the virus. And though you may have grown tired of hearing it, it's even more important now to blanket every corner of the state with this message so that we can help stop the spread of the virus while keeping our businesses open, our kids in school, and our hospitals stable and our essential workforce healthy. In partnership with the Iowa Broadcasters Association and the Iowa Newspaper Association, we were able to leverage special programs and pricing to deliver public service announcements through Iowa's local newspapers, radio stations, and television channels, keeping important messages front and center, and I enlisted the help of some familiar Iowans who are uniquely qualified to help carry the message. From former Governor and U.S. Secretary of Ag, Tom Vilsack, who also knows firsthand the importance of bringing Iowans together for the common good. Suresh Gunasekaran, CEO of UIHC, and Katie Witt, a Test Iowa nurse, each who have a frontline perspective of how the virus is impacting our state and understand better than most why it's so important that every Iowan does their part. Dan Gable, legendary Iowa wrestling coach, Olympic gold medalist, and recent recipient of the Presidential Medal of Freedom. Dan knows what it takes to win, even in some of the most challenging situations. And Carson King, a role model for doing the right thing for the greater good and the incredible difference that it can make for others. So I want to thank each of them for being a part of this campaign and helping us engage Iowans at this most critical time. And now I'm pleased to share one of the television spots that will go out this week. COVID-19 isn't stronger than Iowans' resolve to overcome it.
Together, we can stop the spread of the virus and get life back to normal.
By taking simple steps to protect ourselves and others.
Wear a mask and maintain social distance.
Wash your hands and disinfect commonly used items.
Stay home if you're sick and get tested if you think you have COVID-19.
If you do, isolate from others to avoid spreading the virus.
And get the flu shot so you can prevent further illness and preserve our healthcare resources.
Doing these things will protect you
and those at most risk for serious illness due to age or other health conditions.
The health of all Iowans relies on every single one of us.
We have a personal responsibility to do everything we can to protect each other
and keep our state healthy and strong.
Let's step up.
Let's step up.
Let's step up.
Let's step up.
Let's step up and stop the spread together. Okay. The Iowa Broadcasters Association is now distributing 2 television spots and a radio spot to more than its 200 member stations across the state. So you'll be seeing and hearing this message soon. The spots are scheduled to air through mid-March. And earlier this month, we worked with the Iowa Newspaper Association where they began placing print and digital ads in its more than 250 member newspapers and online publications across the state, and even further expanded our reach to include Spanish and specialty publications. So again, I want to thank the associations for helping us effectively reaching Iowans with this message, and I want to thank the Iowa Department of Cultural Affairs for their teamwork in producing it, Secretary Vilsack, Suresh, Katie, Carson, and Coach Gable for helping to rally Iowans to step up and stop the spread. So in closing today, I want to just make sure that Iowans are aware of the upcoming holiday hours next week at the Test Iowa drive-through sites. All sites will be open for normal testing hours Monday through Wednesday, except for the Council Bluffs site, which will close early at 2 p.m. on Wednesday, November 25th, so that we can get the samples transported to the lab that day and processed overnight along with those from the other sites. And this will ensure that individuals who were tested will still get their results in a timely manner. All Test Iowa Drive sites will be closed on Thanksgiving Day, but all sites will reopen for testing on Friday, November 27th, as usual, from 8 until 4 p.m. And I really do want to thank the State Hygienic Lab, Dr. Pentella, and all of the Test Iowa staff for making it possible for Iowans to continue to be tested over the holiday. It's a critical time for our state, and testing is so important, and I want you to know how much we all appreciate your service to your fellow Iowans, not only next week, but every single day. So thank you, and with that, we'll go ahead and open it up for questions.